of, back in the day, way back, way back. But I'm thinking of modern pioneers, and some of them are actually involved in this program. So, for instance, Professor Peter Figueroa, I respect the work that he did in the Ministry of Health and still continues to do today. He did a lot of work on sexually transmitted diseases and later on HIV and AIDS. And I think this work has helped the Ministry of Health and the Jamaican government and Jamaican people to understand what are some of the problems related to this area of sexually transmitted diseases and HIV/AIDS. More recently, though, I think, although they might not consider it pioneering, the work right here in CARE of the health and lifestyle surveys, I think that is pioneering work, because it's the first time that we were able to look at a range of issues affecting the health of persons in Jamaica. Coming out of this work, a lot of recommendations were made that helped to inform things like the National Health Fund and diseases that they would recognize for treatment and so on. So in my mind, these are pioneering efforts right here in Jamaica.
Professor John Waterlow, I think that he was a critical force in ensuring that research really took off at UWI and in the Caribbean. In those days, they were looking at human metabolism and especially malnutrition. And really, Jamaica led the world in that subject. There's, of course, George Allen, David Picou, Alan Jackson, Mike Golding. All of these are big names. Sally McGregor, Susan Walker, who is still very active. And the research on on nutrition, malnutrition, really helped to guide how you manage malnutrition globally. This is something that the Caribbean has contributed to the world. Sally McGregor, who was the first female researcher of significance, as far as I recall, then initiated in the 1970s looking at the development of the young child and did really some very critical research that showed the importance of early childhood stimulation. And this has been another considerable contribution to the globe, which Susan Walker and her team have continued and developed. There were other Caribbean researchers. There were people like Poon King in Trinidad, Locke, who looked at polio in Guyana. There was Ashcroft. We should also bear in mind that we had many distinguished clinicians whose insights at the time were extremely important. We had vomiting sickness of children due to the hyperglycin component of the unripe ackee, and it's the pediatricians who observed this and brought it to the fore. There was also the question that bush tea was a traditional drink of many Jamaicans, and this was found to be associated with veno-occlusive disease, which affected the liver. Of course, not all bush teas, but Crotalaria, King of the Forest, Whiteback, certain bush teas then contributed to this. Cruikshank and Pamela Rogers made a very astute observation in relation to what they call Jamaican neuropathy, which was later found to be associated with HTLV1 and is now called TSPHAM, tropical spastic paraparesis, or HTLV1 associated myelopathy. And a lot of the research associated with HTLV1 was done in the Caribbean, including Jamaica, as well, of course, Japan. Other pioneers in health research, some of my colleagues, like Deanna Ashley, Afet McCaw-Binns, Rainford Wilkes, Terence Forrester, all of these are colleagues, friends, and people who have contributed greatly to research in the Caribbean.
Pioneer was a surgeon at the Kingston Public Hospital in the 19th century called Michael Grabham, who after our first vital registration data was published, first Registrar General's report was published with a maternal mortality ratio of what is over 600 per 100,000. And the registrar suggested that we needed skilled birth attendants. Michael Grabham took that information and was ceaseless in his efforts to ensure that we were training midwives in Jamaica. And in 1887, I think it was, the Victoria Jubilee Hospital and School of Midwifery opened and began training midwives. And the deployment of midwives at the beginning of the 20th century into communities contributed to a massive fall in our maternal mortality ratio, especially from infection-related deaths than previously. Christine Moody was the director of primary health care in Jamaica in the 1970s and 80s, and she saw to the expansion of primary health care facilities right across the length and breadth of Jamaica. Today we have over 300 and odd primary care centers that have brought basic health care within 10 kilometers of 90% of the Jamaican population. So people have access to some basic health care not far from where they live. And those things, I think, have helped to improve Jamaicans' health status